as well as the surfaces. Everything needs to be cleaned. So when you're dealing with a hospital, if you want to reduce your hospital-acquired infections, if you want to lower your cost of that significant problem in your hospitals, the first thing you could do is improve your hand hygiene. Now, when a doc or nurse or caregiver washes their hands, there's a procedure to do it correctly, right? It's warm water, it's soap, it's sing the ABCs twice, right? We all teach our kids this stuff, but docs and nurses don't do that. They don't do it properly. Not all of them. I'm on tape here, so I don't want to make a generalization. But what happens is a doc goes in to insert a catheter. One of the biggest reasons why we get hospital-acquired infections is catheter insertion. They don't properly hygiene themselves. Or they do properly hygiene themselves, and then they come over and ask you how you're feeling today. Guess what? They just put their hand on your bed rail. They are now contaminated. Or guess what? They walk over, you have the cubicle curtain shut because you want some privacy. They walk over, they just clean their hands, they open the cubicle curtain. Guess what? They're not contaminated again. So you have all this contamination going on. So they'll do the same thing. They'll put on the latex gloves, nice new latex gloves like they're supposed to, and then they'll touch something. Now they know not to do that, and they're not doing it consciously. They're doing it unconsciously. But that's one of the reasons we have these problems. Guess what the #2 way to reduce hospital-acquired infections is?
Carpet.
Wrong. Who said carpet? Give me your Starbucks card back.
Yes, it is because it stops the airborne.
It's actually a very good proponent of stopping airborne contaminant if properly maintained. I thought you meant that you needed to rip the carpet out in order to stop it. You can keep your Starbucks card. All right, #2, surface sanitation. The CDC clearly states in their 2003 infection control guidelines that surface sanitation is intimately important to reducing hospital-acquired infections. You need to make sure that things that people touch are cleaned on a regular basis. They classify surfaces as high touch and low touch. Guess where carpet is? It's right with the floors and the walls. People don't walk around hospitals dragging their hands on the floor. They don't walk around and touch the ceilings. Okay? It's the grab bars. It's the door handles. It's the water faucets. It's the faucets you turn on your water with. These are the things that people are touching every day, and they're cross-contaminating one another. These are the surfaces that need to be disinfected on a regular basis. You'd be better off taking your environmental service team and stop cleaning your flooring completely. I would recommend that. And just have them stand at every door with a Clorox wipe. And every time someone opens a door, wipe it off. That would be better infection control than cleaning your floor covering. By definition. Right? Make sense? Now, how many people think that carpet actually does, like I said earlier, some people put their hands up, aid, or not aid, but more, have an effect on hospital-acquired infections? Most people believe that the flooring does have an effect, right? Well, let's look at what the experts say. You're wrong. There is no science whatsoever that claims that extraordinary cleaning or decontamination of floor covering is warranted in a healthcare setting. That's the CDC's quote, that's not me. No empirical evidence whatsoever. Not one study ever done has directly related a floor covering to a hospital-acquired infection. And as the very astute colleague in the back said, in some cases, a soft surface or textile flooring will help to control airborne contaminants because they're going to flow down thanks to gravity. They're going to get trapped, not stuck, but trapped temporarily in your flooring. These are all great floor coverings for healthcare. Do any one of these aid in the control of airborne contaminant matter? Zero. I just told you that hospital-acquired infections are spread airborne and hand-to-hand. These do nothing to help you as far as airborne contaminant matter. Every time you walk on these floors, you kick everything back up into the breathing zone. So why are we ripping out all of our carpet and putting this in? Well, we're doing it because of this. That's worse. All right? So what we want is we want a floor covering that can control airborne contaminants, that can be cleanable, that you can remove them, you can extract them. Now here's the problem. If you don't clean your floor covering, I don't care which one you pick, I don't care. If you don't clean it, you are going to have a problem. Regardless if it's hard surface, resilient, or carpet, or hybrid, doesn't matter. You need to have a routine maintenance program. That's my disclaimer. Which, by the way, CDC quotes again. Newly cleaned floors become rapidly recontaminated. So when you're mopping a floor or Swiffing a floor or vacuuming a carpet, whatever you're doing to your hospital corridor, As soon as you're done with one end of the floor, and someone comes off the elevator and walks down, it has now been recontaminated. You can start all over again. Now, do you do that? Do you constantly mop or vacuum your floor every single minute? Do you follow people around in Brookdale Senior Living, the wheelchairs, and make? No, you can't do that. It's not theoretically possible. Don't worry about it. You don't have to do it. It's not important. Regular, routine maintenance is all that's required on any floor covering. Now, whether you think it's easier to do regular maintenance on this or regular maintenance on this, you have to decide. But they both require regular routine maintenance. All right, this is kind of a touchy subject. We have a lot of ladies in the room, so I can use this. How many of you right now have a little thing of Purell in your pocketbook? Put your hand up. Good. Almost the entire room. Throw that stuff away. No, I'm kidding. All right. So you obviously feel there's a benefit to that alcohol-based, antimicrobial, germ-killing, bacteria-killing compound, right? You're carrying it around, so you obviously support that. So do you think that there's any evidence that supports the use of that product has anything to do with helping you be healthier as a human being? You would think there would be, right? There isn't. Okay? There's no evidence, once again, supporting the use of antimicrobials, particularly in flooring. Now, I can't talk about cubicle curtains. I can't talk about fabrics on chairs. That's not my expertise. My expertise is floor covering. There is no evidence whatsoever that supports using antimicrobial treatments in floor covering has any health benefit. Zero. Now, let me ask you a question. Why would people who sell products like this put antimicrobial treatments in their backing or their adhesive? They charge for it, yeah.
Make you feel better.
Right. Because they have a failing product. If I'm selling you a product, if I went to you and said, hey, I'd like to sell Aurora, this revolutionary floor covering we made for healthcare, but by the way, everywhere there's a seam, stuff's going to leak through and bleed through, so I'll tell you what I'm going to do. I'm going to put an antimicrobial treatment in my backing and my adhesive so you don't have to worry about that bleed through. Sounds pretty good, right? Pretty convincing? Now let me tell you exactly what it really is. Any antimicrobial treatment in floor covering is also known as a registered pesticide with the EPA. In order for antimicrobials to be used in floor covering, they are registered pesticides with the EPA. So let me give you my sales pitch again. I like to come in and sell you a revolutionary floor covering designed and engineered for the healthcare environment. And by the way, don't worry about things seeping through my seams because I have a registered EPA pesticide in the backing and the adhesive so that I can protect you against that. How well is that sales pitch going to go? We don't want chemicals in our indoor environment. We want to reduce chemicals from our indoor environment. You want to buy products that are cleanable, where the contaminants stay on the surface. You don't need antimicrobial treatments in carpet, backings, or adhesives if the backing and adhesives doesn't fail. Does that make sense? Why would you buy a chemical and pay extra and put an indoor pollutant into your environment if you don't need to? Does resilient floor covering come with an antimicrobial backing or adhesive? Thank you, Tom. Why? You don't need it. You spec the right product. So, I can't make a general statement I did earlier, I want to correct myself, that antimicrobial treatments of all kind are not good. I personally believe they're not. I believe they do more harm than good. I think they break down your natural defenses against that. I travel every day of my life. Think about this. I'm in the most germ-infected places in the world, except for American hospitals, apologize, all right? But the other two most bacterial rampant places in the world, known as airports, airplanes, and hotel rooms. That's where I live. I've had one cold in 2 years. I'm not a germaphobe. I shake people's hands. I'll even hug you after I know you have a wall. Okay, I'm not. What I'm saying is, why don't I get infected? Because I don't touch things in an airplane or a hotel room that I know has been cross-contaminated 1,000 times and never been cleaned. I'm not going to open the air vent in my airplane. I'm going to use a tissue. Now you may say I'm a germaphobe, but no, I'm just doing what's protecting myself because I know 1 million people have opened that thing up that just sneezed on themselves and that never got cleaned. Do you think the airplane ever cleans that little thing? How about the window shade? How about the magazine in the back of the seat in front of you? Don't read that. Are you crazy? Bring your own magazine. Look. Oh, where is it? I bring Men's Health on every plane I go on. All right? Don't read the stuff in the back.